journey into understanding one of the most common, yet often misunderstood, illnesses, pneumonia. Today we're diving into what pneumonia really is, a serious infection that targets your lungs, making it difficult for your body to get the oxygen it needs to function at its best. Imagine your lungs as two spongy balloons inside your chest. Every time you breathe in, they fill with air, delivering life-giving oxygen to every cell in your body. This process is essential for energy, movement, and even thinking clearly. Pneumonia happens when these balloons become infected, usually by bacteria, viruses, or sometimes fungi. The infection causes the air sacs in your lungs to fill up with fluid or pus, instead of air. This makes it much harder for you to breathe and for your body to get the oxygen it needs. When you have pneumonia, you might feel extremely tired, weak, and short of breath, almost as if you're trying to breathe through a wet sponge. You may also have a cough, fever, chills, or chest pain that gets worse when you breathe deeply or cough. Pneumonia can range from mild to life-threatening. For some people it's a minor setback, but for others, especially those with weaker immune systems, it can be very serious. Your age, overall health, and the specific germ causing the infection all play a role in how sick you might get. For healthy adults, pneumonia might feel like a really bad cold or the flu, but for young children, older adults, or people with chronic health conditions like asthma, diabetes, or heart disease, it can quickly become dangerous and even life-threatening. That's why understanding pneumonia is so important. Knowing what it is, how it spreads, and how to recognize the symptoms can help you get the right treatment quickly, and even prevent it in the first place. Pneumonia is more common than you might think. Every year, millions of people around the world are affected by it, and it can strike anyone, anywhere, at any time. But with the right knowledge, we can reduce the risks and protect ourselves and our loved ones. In this video, we'll explore what causes pneumonia, how to spot the warning signs early, and the best ways to protect yourself and those you care about. We'll also talk about treatments, recovery, and how simple steps like hand washing and vaccines can make a big difference. Remember, knowledge is power, especially when it comes to your health. The more you know, the better prepared you'll be to stay healthy and help others do the same. By learning about pneumonia, you're taking an important step toward a healthier, safer life for yourself and your community. So, let's get started and discover everything you need to know about this important topic. So, what causes pneumonia? Pneumonia is an infection that inflames the air sacs in one or both lungs, and it can be triggered by a variety of different germs. Understanding what leads to pneumonia is important because the cause can affect how the illness develops and how it's treated. Most often, pneumonia is caused by germs, mainly bacteria and viruses, but sometimes fungi or even other microorganisms. These germs can enter your lungs when you breathe in tiny droplets from a cough or sneeze, or when you touch your mouth or nose after being in contact with contaminated surfaces. Bacterial pneumonia is the most common type in adults, and it's often caused by a bacterium called Streptococcus pneumonia. This type of pneumonia can develop on its own, but it's especially likely to occur after you've had a cold or the flu, which can weaken your lungs and make it easier for bacteria to take hold. Viral pneumonia, on the other hand, is caused by viruses like influenza, respiratory syncytial virus, RSV, or even the common cold. It's more common in young children, older adults, and people with weakened immune systems. Sometimes viral infections can pave the way for bacteria to move in, leading to a mixed infection. Viral pneumonia is often milder than bacterial pneumonia, but it can still be serious, especially for those at higher risk. Symptoms can range from mild to severe, and sometimes people need to be hospitalized for extra care. There's also a less common type called fungal pneumonia. This usually affects people with weakened immune systems, such as those undergoing cancer treatment, people with HIV/AIDS, or the elderly. Fungal pneumonia can be caused by fungi found in soil or bird droppings, and it's more likely to occur in certain parts of the world. Most healthy people can fight off these germs before they cause any problems. But sometimes if your immune system is weakened, or if you're exposed to a particularly strong germ, the infection can get past your body's natural defenses and settle in your lungs. Knowing exactly what's causing the pneumonia is important, because the treatment depends on the type of germ involved. For example, antibiotics can treat bacterial pneumonia, but they won't help with viral or fungal pneumonia. That's why your doctor may order tests, like blood work, sputum samples, or chest x-rays to help identify the specific cause. Pinpointing the germ helps your healthcare team choose the right medicine and the best treatment plan for you. If you're feeling unwell, especially if you have a cough, fever, or trouble breathing, it's important to see a doctor. Early diagnosis and treatment can make a big difference in how quickly you recover and help prevent complications. Each type of pneumonia needs a different approach, and your healthcare team will work together to find the best way to help you get better. Next, let's look at how to recognize the symptoms of pneumonia so you know when to seek help. Your body is always communicating with you, sending out signals when something isn't quite right. These signals are what we call symptoms. Paying attention to these early warning signs is crucial, especially when it comes to illnesses like pneumonia. Pneumonia can affect people of all ages, and its symptoms can range from very mild to extremely severe. The most common symptoms to watch for are a persistent cough, a high fever, and difficulty breathing. These symptoms often develop suddenly, but sometimes they can come on more gradually, making them easy to overlook at first. The cough may start off dry and irritating, but as the infection progresses, it often becomes more severe and may start to produce mucus. This mucus can be yellow, green, or even streaked with blood. Along with the cough, you might experience a high fever, chills that make you shiver, and sweating as your body tries to fight off the infection. These symptoms can leave you feeling extremely tired and weak, making even simple daily tasks feel exhausting. Fatigue is a common sign that your body is working hard to recover. Shortness of breath and chest pain, especially when you take a deep breath or cough, are also important symptoms to notice. Breathing may feel shallow or labored, and chest pain can be sharp or dull. These are key signs of pneumonia. In some people, especially older adults, pneumonia can cause confusion or disorientation instead of the classic symptoms. This can make it harder to recognize the illness right away. Other symptoms you might notice include a headache, muscle aches or pains, and a loss of appetite. You may not feel like eating or drinking, which can make recovery even more difficult. Not everyone will have all of these symptoms, and sometimes they can be mistaken for a bad cold or the flu. But if you have a persistent cough, a high fever, and trouble breathing that doesn't improve, it's important to take these signs seriously. These are strong signals that your body needs help. If you or someone you care for is experiencing these symptoms, don't ignore them. Early recognition and prompt medical attention can make a big difference in recovery. Next, let's see how pneumonia can look different in children and older adults. Pneumonia can look very different in young children and older adults. Babies may not cough much but might be fussy, tired, or have trouble feeding. Watch for fast or difficult breathing or a bluish color around the lips. These are serious signs. In older adults, symptoms can be subtle. Confusion, weakness, or a drop in appetite. Sometimes, there's no fever or cough at all. A sudden fall or confusion in an older person can be a warning sign. Because symptoms are less obvious, family and caregivers need to be alert. If a child or older adult seems off, seek medical advice quickly. Early action can save lives. Now, let's see how doctors diagnose pneumonia. If you think you have pneumonia, see your doctor. Diagnosis starts with questions about your symptoms and a physical exam. Your doctor will listen to your lungs for crackling or bubbling sounds. If pneumonia is suspected, a chest X-ray is usually ordered to look for infection. Blood tests or a sample of your mucus may help identify the germ. In severe cases, a CT scan or more tests might be needed. These steps help your doctor choose the best treatment. Quick diagnosis means faster recovery. Don't wait if you feel unwell. Early treatment is key. Next, let's talk about how you can prevent pneumonia. Prevention is always better than cure. Let's see what you can do. Here's how to protect yourself. The best way to fight pneumonia is to prevent it. Wash your hands often with soap and water, especially after coughing, sneezing, or before eating. Eat a healthy diet, exercise, and get enough sleep to keep your immune system strong. If you smoke, quitting is one of the best things you can do for your lungs. Avoid close contact with people who are sick. Cover your mouth and nose when you cough or sneeze. Clean surfaces that are touched often. These simple habits lower your risk and help protect others. Prevention is about building healthy routines. Small steps make a big difference. Next, let's talk about vaccines, a powerful shield against pneumonia. Vaccines save lives. Vaccines are one of the best ways to prevent pneumonia. The pneumococcal vaccine protects against a common cause of bacterial pneumonia. It's recommended for young children, older adults, and people with certain health conditions. The annual flu shot also helps, since the flu can lead to pneumonia. Other vaccines like Hib and whooping cough protect against germs that can cause pneumonia. Make sure your vaccinations are up to date. Talk to your doctor about which vaccines you need. Vaccines are safe, effective, and protect your community. Now let's look at how pneumonia is treated. If you're diagnosed with pneumonia, don't panic. Treatment works. Bacterial pneumonia is treated with antibiotics. Finish the full course, even if you feel better. Viral pneumonia doesn't respond to antibiotics. Rest, fluids, and over-the-counter medicines help manage symptoms. Sometimes, antivirals are used if the flu is the cause. Fungal pneumonia needs antifungal medicine. Rest is crucial. Your body needs time to heal. Don't rush back to work or school. Most people recover in a week or two, but tiredness can last longer. Follow your doctor's advice and take care of yourself. If you're not improving, contact your doctor. Recovery takes patience. Let's talk about when to seek medical help. Know when to get help. Pneumonia can get serious fast. Call your doctor if you have a persistent cough, high fever, or trouble breathing. Go to the ER if you have severe shortness of breath, bluish lips or skin, chest pain, or confusion. These are emergency signs, especially for young children, older adults, or people with chronic health problems. Trust your instincts. If something feels wrong, seek help. After starting treatment, monitor your symptoms. If you're not getting better or suddenly feel worse, call your doctor. Early action can prevent complications. Your health is your most valuable asset. Don't hesitate to ask for help. Stay healthy and informed.